narcolepsy is a neurological disorder that disrupts the brain's ability to regulate normal sleep-wake cycles, but it often has psychiatric implications and affects one's mental health and overlaps with mental health issues. One may ask, what is narcolepsy? So narcolepsy, for it causes excessive daytime sleepiness. Someone is too sleepy during the daytime, where people feel overwhelming, sleepy, and can fall asleep suddenly and uncontrollably during the daytime, even after full nights of adequate sleep. So these people with the narcolepsy enter REM sleep usually within 15 minutes. So the usual sleep cycle is typically 60 to 90 minutes. So you see now this is a mixing of sleep and wakefulness. So, and other symptoms include cataplexy. Cataplexy is basically a sudden muscle weakness triggered by strong emotions, sleep paralysis, inability to temporarily move when falling asleep. And the person may also have vivid hallucinations in sleep transition. So the narcolepsy and psychiatric conditions, we look at this relationship between narcolepsy and psychiatric conditions. Though narcolepsy is a neurological disorder, it is often misdiagnosed and confused with other psychiatric disorders because of the symptoms like hallucinations, sleep paralysis, and sudden muscle weakness. And sometimes a person may start experiencing seizures when you don't have adequate sleep. Even if you're a normal person, when you don't have adequate sleep, most especially for children, their brain is still developing and they are not getting adequate sleep. Someone can develop those seizures. So adequate sleep is paramount for all growing children. Okay. So high rates of psychiatric comorbidities are seen with narcolepsy, whereby you see that most of our patients in the wards, they are having a comorbidity of narcolepsy, and they go undiagnosed because even the psychotics, antipsychotics, have their own side effects, and you find that this patient is quite sleepy, and no one goes deep to investigate why is the patient always having the sleep, not having sleep, or having sleep during the daytime. So those are the things that need to be handled critically. So with narcolepsy, it has a comorbidity of depression and anxiety. The patient may be withdrawn, and this condition affects one's daily functioning and social life. So there is a serious interplay between sleep and mental illness. So that is where the interplay is. So isolation also can also be there, because the person is also isolated because he puts himself in a certain corner and sleeps off. And there is also poor concentration. The person cannot concentrate in his or her daily activities. So we are going to look at what are the possible causes of narcolepsy. Narcolepsy is basically caused by a brain not having enough chemical. That chemical is basically known as hypocretin. hypocretin is secreted from the hypothalamus, the side of the brain called the hypothalamus, and it regulates arousal, wakefulness, and also appetite. So that is the basic function of what? Of that chemical found in the brain. And the lateral side of the what? Of the hypothalamus. So deficiency of this chemical causes an autoimmune attack onto the brain. So that's when you see that someone is having mixing up sleep and wakefulness, because there is inadequate what amounts of that chemical called the hypocretin, causing an autoimmune what attack to the brain. So it is not basically narcolepsy is not a mental illness itself, but often affects one's mental health. So the other factor that causes narcolepsy is basically genetic. For some people it's genetic, that one we cannot rule it out. And also other environmental factors can also lead to someone having narcolepsy. And the environmental factors that are associated with stress, and also infections. Infections can lead to narcolepsy. So, and you find that someone's condition can be confused with other psychiatric conditions. So narcolepsy is a neurological disorder with strong psychiatric overlaps, causing daytime sleepiness and symptoms that mimic the coexistence of mental issues. Their symptoms are close to mental issues, and most times they are even misdiagnosed. You may misdiagnose a person with narcolepsy with having a psychosis, because the symptoms are can drive a clinician easily. If he is not very keen, he will go with psychosis, and yet it is narcolepsy. So we have to be quite keen when you are diagnosing these patients. So for proper management, we look at narcolepsy as something very much significance, such that we can give proper management and address both sleep and psychiatric symptoms to improve on the quality of life. And so this one also recognizes narcolepsy in psychiatric patients to improve sleep and mental health outcomes. So that is what is basically we need to know about narcolepsy. Thank you very much.